Hello, I'm Wyatt Spears, and today I'll be giving a speech about suicide as a public health issue, a comparative analysis on the US and Germany. So, suicide is a global health concern. Over 700,000 people die by suicide each year. Um, it affects individuals of all ages and backgrounds and poses a significant burden on healthcare systems and governments around the world. Um, so for this, we'll be focusing on the United States and Germany, two industrialized nations with advanced healthcare systems, but differing attitudes towards public health and mental health, as well as systems of administration for public health. So suicide in the U.S., the suicide rate is about 14.1 suicides per 100,000, with firearms being the most common method, accounting for over half of these instances. Um, this highlights the interchange between mental health and gun control in the U.S. Both are major issues we face currently, and both affect each other. While suicide in Germany is 10.7 suicides per 100,000, and the most common in Germany are hanging or poisoning. So, unlike the US, they have strict gun control that helps to eliminate uh, the use of firearms in suicides. So, people in Germany use other methods, such as hanging. So, monitoring the problem. The U.S. relies on data from the CDC, which is the Center for Disease Control, and the NIMH, which is the National Institute of Mental Health, while Germany utilizes Die Statis and the Robert Koch Institute to analyze suicide trends. Um, so they have kind of similar agencies to monitor the problem. So trends over time. Um, Both countries experienced declines in suicide rates during the late 20th century, but rates have begun to rise again in the 2010s, likely due to socioeconomic stresses and worsening mental health trends. So for Germany, as you can see towards the end, it has started to level out around 15 uh, from the last from 2014, and since then it has still been dropping. But in the U.S., it has been slowly rising. So in 2015, it was almost at 15. Um, it has gone down a little bit, but it's still a major issue. Um, so the response in the U.S. It has a suicide and crisis lifeline, which is 988, and the SAMHSA initiatives to support prevention and community service and do outreach to affect communities that tend to have higher um, suicide rates. And Germany's response is similar with the National Suicide Prevention Program and a free crisis line like telephone Seelsorge. Healthcare systems overview: U.S. private and public mix, um, and Germany is a universal public insurance. Um, the big issue between the two countries is accessibility to care. Germany has a mental health coverage included for public health insurance, while the U.S. is often limited. And a lot of the issues we see in the U.S. is access to health insurance care that will help towards mental issues. Cultural views on mental health. Both countries combat stigma. In the U.S. especially, there's a major change in stigma between the South, which is tend to view it less as an issue versus in the North or West where it is spoken a lot more. Um, the role of firearms in the U.S. plays a major factor in suicides, but in Germany it is less of an issue again because of their strict gun laws. Government support structures. The centralized healthcare systems and government in Germany facilitate consistent support, while conversely, the U.S. approach varies from state to state and among local governments, making services inconsistent. School and workplace programs. Both countries promote suicide prevention in schools and workplaces. Programs aim to cultivate awareness, enhance mental health literacy, and provide crisis intervention training. So, developing country comparison. I chose Nepal. It is um, faces challenges with infrastructure, mental health resources. Most care is free for service, and the country has limited access to quality suicide statistics, highlighting global mental health inequalities. So, U.S. and Germany are detailed and consistent, while Nepal lacks the capability to accurately measure suicide data. What is working, what is not? Germany's infrastructure supports extensive availability and coordination of care, while the U.S. also has improved through initiatives like the 988 hotline, but continues to struggle with affordability and access disparities. Um, so recommendations. The United States should enhance access to mental health care while addressing the accessibility of firearms as they are a main driver in the issue. Both countries should maintain focus on vulnerable populations, especially teenagers and those in rural, isolated communities who would lack support. Conclusion. Suicide is a preventable problem. It is complex, but still preventable. Policy, access, and public awareness are key. Comprehensive policy, equitable access to mental health services, and cultural sensitivity interventions are essential for progress in both the U.S. and Germany. Thank you.